Good afternoon. This is Assemblywoman Petrie-Norris. Thank you so much for joining us today for our Facebook Live Town Hall. Today, we will be answering your questions about the COVID-19 vaccine. With the vaccine rollout underway here in Orange County and all across the country, there really is light at the end of the tunnel. It feels like there is renewed hope. We know that it's not doing anyone any good with these vaccines just sitting in a warehouse, and we are moving heaven and earth right now to ensure that we get them off the shelves and into arms so that we can defeat the COVID-19 pandemic, that we can beat this crisis and reopen our economy and start to rebuild our communities. I am so pleased to be joined today by the director of the Orange County Healthcare Agency, Dr. Clayton Chau. Dr. Chau, thank you so much for joining us.
Thank you, ma'am. Hello, everyone.
I was joking before we turned our cameras on that Dr. Chau really is the busiest man in Orange County right now. So really, really pleased to have him here with us to answer your questions. And for folks that are joining us watching this on Laguna Woods Village TV, if you would like to ask questions as we're going through the town hall, you've got two options. You can visit my Facebook page, or you can call into our office, which is 949-251-0074. So with that, let's go ahead and jump into your questions. Dr. Chau, as I mentioned, we've gotten a few questions in the office about the safety and effectiveness of the COVID-19 vaccine. So I really want to start there. So first question, this vaccine was developed in record time as part of, it was Operation Warp Speed. How can I trust that it is safe?
Yes, so thank you for that question. That is a very important question. In a normal time prior to the pandemic, usually when you study a drug or a vaccine, the FDA required that you have to go through different phases. And the most important phase, so phase 3, is when you test in human for the effectiveness as well as the safety measure of that. And usually for any new product, it really takes quite a few years in order for a manufacturer to recruit enough people into the study and to make sure that there's a well representations of from different ages, adults of course, as well as different ethnic background, and so that you have a well representation of the population that you deal with. Because of the pandemic, and because of the infections rate all over the world, and because of people who are dying from this pandemic, when these manufacturers issue the pilot study across the world, asking people to volunteer to participate in the study, there were a lot of people who volunteer, who were willing to be the subject, because everybody wants to find the solution to this deadly virus. And I'm going to say that, although there are people who disagree with me, right? By the way, U.S. crossed over 400,000 deaths this week. If you look at the 5 years of World War II that we were part of, and the 15 years of the Vietnam War that we were part of, the number of Americans died in those two wars, all 20 years, less than the last 10 months. I want you to keep that perspective, right? To dispel the myth that this is not a terrible virus. It is a terrible virus. Too many American lives have lost in such a short time.
It really does. It really does put it in perspective. This is an unprecedented public health crisis. As you said, we've lost more than 400,000 American lives, and each one of those is a person, is a father, is a son, is a mom, is a friend, and so the quicker that we can get this vaccine rolled out all across our communities, the more lives that we are going to save, and the quicker we are going to be able to get back to normal, and get back to the pre-COVID era.
So it has been a worldwide effort. Everybody want to participate in these study trial because everybody want to have a solution, a global solution, right? It's not
Mhm.
just American. And so that's number one. And that's why the manufacturer was able to quickly study in a significant number of people. For the two vaccines that we have so far that have been authorized by the FDA, you heard of Moderna and Pfizer. There were well over 76,000 people worldwide participated in the study for these two drugs alone. Okay, number one. Number two, usually a manufacturer will wait until all the studies done and then they get the approval of the FDA, then they start producing the drug, right? But again, because anticipating that this is new technology, the technology has been studied for the last 2 decades. So there's a lot of promising
Mhm.
in this type of vaccine. And so early on, when they started to study the drug, there already been um, resources, financial resources, pour into manufacturing these vaccines ahead of time by all countries, not just the US. All countries put in money. So, the first one got approved in the world was Great Britain, the UK,
Mhm.
because they also put a lot of money into producing the virus so that the minute their version of FDA and our FDA authorize it, then it's ready to go, right? You don't have to wait long. And so all of that factor packaged into a short period of time in a matter of 10 months, we were able to authorize two vaccines. So I want to assure you that the FDA did not allow the manufacturer skip any important step at all. All the step was done properly, been vetted, as you know, early December, December 10th to be exact, was the first day that the FDA authorized our very first vaccine, the Pfizer vaccine. And they had the FDA had a panel of experts in immunology, allergy, and virology looking into this, right? And
Mhm.
review the application. Simultaneously, California and Nevada and Oregon and Washington State also had our own expert scientific panel review that would also review the application at the same time with the FDA. So these four states did not say okay just because the FDA said okay. We also had our own expert in our own four states looking at the application at the same time. And so December 16th in Orange County, we had our very first person in Orange County who got the vaccine. I was there and I tell you, I was very emotional because I have a friend who died from the virus at that hospital where the first patient got it. And I was a mess. So people who saw me there, although you might not saw me on TV, but I was a mess. I was crying because for the very first time in 10 months, there's true hope for our community.
Yep. Yeah, it's an incredible turning point. It's an incredible achievement. It seems almost like a miracle. But as you said, we were able to develop this vaccine in a relatively short period of time because it had been based on decades of work that had
Yes,
already been underway, and
yes,
because of the incredible cooperation and mobilization of the international community.
yes,
And it has been validated by our nation's and our state's top medical experts
yes,
to be safe.
yes.
And now let's talk just a little bit about how effective
Okay.
this vaccine is.
So the beauty and by the miracle of God, and I'm a person who really have strong faith, by the miracle of God, um, both the vaccine that was authorized um, have an incredible percentage of effectiveness, 95 and 94%. That's incredible, right? Our seasonal flu vaccine every year that we got, right? At best, 60 to 70%
Wow.
seasonal flu vaccine,
Wow. Okay.
okay? These flu vaccines are 95% effectiveness, okay? So by the time you get your second dose, a week after you get the second dose, And the time frame between the first and the second dose depends on which vaccine. For the Pfizer vaccine, is 21 days, 3 weeks. For the Moderna vaccine, is 28 days, 4 weeks. Okay, so by the time a week after you got your second dose, you complete your cycle, effectiveness is 94% for Moderna, 94.1% for Moderna, and 95% for Pfizer. That's incredible. That is absolutely incredible.
So both the Moderna and the Pfizer vaccine are some of the most effective and best vaccines that have ever been created, kind of on par.
The flu vaccine.
Chickenpox, measles vaccine in terms of the efficacy. Is there a difference? So if I, do I care if I get the Moderna vaccine or the Pfizer vaccine?
So that's the myth. Is there a difference, right? And there's even another myth out there that, oh, Moderna is more effective for Asian. That is not true. There weren't enough Asian study for that to be power, right? But it's across the board. Everybody's the same effectiveness. It doesn't matter which vaccine. There's no difference because the science of these two vaccines are the same. Okay, the way they are packaged is a bit different, but the core science of these two vaccines is the same. So it really doesn't matter which one.
Okay, and one last question, because I've heard this from a couple people. So does this actually stop me from getting COVID-19? I read that it doesn't stop me from getting COVID, it just makes the symptoms less severe. Is that true?
That's correct. And it related to the next thing I'm going to say, okay? So it does not, just like the flu vaccine doesn't stop you from getting the flu virus, but once you get the flu virus, you don't have symptom.
Okay.
Okay, so same thing. You can still get the COVID virus, but if you are the 95% that is effective, then you won't feel anything. Or if you have symptoms, it'd be really mild and not even that, right? So we believe that people who get vaccinated, the 95% where it's effective, they will be asymptomatic.
Okay.
The other 5% that if you fall under that is not effective for you, you will get symptom.
Okay.
And so it means that you could still be a carrier. Okay. What we don't know is if you got the vaccine, even though you are protected from having symptoms and then you got the virus, will you be a spreader? Okay. At this point, we believe that you can probably will still be able to spread the virus to somebody else. And that's why we encourage people that even after you get the vaccine, complete your cycle, you are protected. You still need to wear a mask because the majority of our community have not gotten the vaccine yet. We have to wait until we reach herd immunity, and then we can be a bit relaxed, right?
Okay. So,
and
you said, as you were saying, some of these things we're still learning, and I think that's been, I think, the incredible, but also I think for a lot of folks, a really challenging part is because this is so new, we are learning new things each and every day, and the top medical experts in the county and across the nation, we're learning things every day about this vaccine. So sorry, about the disease and now about the vaccine. But I think the message that we want folks to take away is it is safe, it is effective. I actually read an article just before I got on this call where a noted epidemiologist was quoted, and he said it is ridiculously effective. It should be celebrated, in the same way that the rollout of the polio vaccine was celebrated. It is a turning point and a miracle, really, that is bringing so much hope for so many of us.
It truly is. And so what I could say to our community is there is no reason on why someone would say no to this, right? There has been some myth around, would it integrate or incorporate into my DNA? No, it doesn't, right? Would it cause infertility? No. In fact, there was 23 women who were pregnant during the trial, right? 12 of them got the active vaccine, and the other 11 was on the placebo arm, meaning
Mm-hmm.
they did not get the vaccine. And actually, one of them miscarried, but the person who had the miscarriage was the one who received the placebo. So it had nothing to do with the vaccine, right? So in
Okay.
case you heard rumor, that's the fact. Okay.
Okay.
23 women got pregnant doing this trial. If you ask me, were they American women or other, I don't know. And I can't tell you where, but we know there were 23 women who was pregnant during the clinical trial. 12 was receiving the vaccine. 11 did get the placebo, the non-vaccine arm. And the woman who miscarried was the one who did not receive the vaccine. Okay,
Got
so
it.
make
Okay.
very, very
All right.
clear.
So it's safe even for pregnant
That's correct.
women,
That's
which is
correct.
good to know. We actually did have a question from a pregnant woman.
Yes.
So that is,
And in
is
fact,
good
in
to know.
some country, they recommend that pregnant women are at a higher risk, and therefore they should receive
COVID.
the vaccine first, right?
Okay.
So
Okay.
I want to put it out there and dispel the myth, okay?
Okay. Well, and as I'm sure it won't surprise you, we've got a lot of questions from folks
Yes.
about, where and when am I going to be able to be
Got it.
vaccinated? So,
Got it.
as you said, the very first vaccine was distributed in the county, you said on December 16th.
16,
We are
yeah.
just over a month into this
Yes.
journey.
Yes.
So, can you just give us an overview? How is the vaccine being rolled out across Orange County? And what can people expect at a high level?
Got it. Thank you, ma'am. So currently, there are 3 ways that the vaccine comes to Orange County, okay? Similar to any other county, Orange County, okay? The first way is the vaccine has been allocated directly from the federal government to long-term care facility residents and staff in Orange County. Okay, so what happened is there are 72 skilled nursing facility and over 1,000 various sizes of assisted living residential program in Orange County. They have a contract with, the federal government has a contract with CVS and Walgreens Pharmacy to get the vaccine directly from the federal government to vaccinate the staff and the individual who live in this long-term care facility in Orange County. That process started on December 28th. I remember the date too, okay? And so it's rolling out. I know some of the large skilled nursing, almost all the skilled nursing facility have gotten their vaccine. And then some of the larger residential program have gotten the vaccine as well, okay? So that's one route the vaccine come to Orange County. The second route is what they refer to as multi-county entity. These are entities that have footprints in more than 3 counties in California. Okay, so here in Orange County, the multi-county entity, MCE entity, are Kaiser Hospital Health System, Providence Health System, and UCI. Okay, so they receive their allocation directly from the state. Okay, then the rest of everyone else, the allocation come from the state to the healthcare agency directly. Okay, and then we assist and we allocate to all these entities, including the non-MCE hospital, the primary care physician offices, the community clinic, the dentist, etc. Okay.
Got it.
And the first phase of people that the federal government and California wanted us to vaccinate are the what we call critical and healthcare workers, people who interact a lot with the public, right? Especially people who interact with a high-risk public, right? So people who work in the hospital, they're taking care of folks in the emergency room, in the intensive care unit, etc. So those are the first group. In Orange County, we have had outbreak in jail in late December to early January. And so you probably read the news already. In Orange County Jail, we had an outbreak with hundreds of people get infected and staff and what have you. And so we decided to also vaccinate our law enforcement people who work in high risk area, right? Because that makes sense, okay? And then about a week, more than a week ago, when I look at the data in Orange County. So Orange County has what we call a community vaccine task force that I started early September to help us to make decision on how to prioritize people and make sure that the most vulnerable in Orange County do not fall through the crack. Right, and that task force is well represented from people in academia, bioethicists, representation from the labor union, to the teachers, to the school, to the parents. We have representation for senior on that task force, community-based organization, faith-based. So even Bishop Vance sent Bishop Fryer to sit on our task force. Right? And then we have an interfaith entity that represents other faith on our task force as well. I welcome you to go on to ochhealthinfo.com/forward vaccine task force. And the list of all those people there, right?
Oh, great, great.
So the task force is helping, guiding us in the decision that we make. So 2 weeks ago, and so Orange County currently under the lockdown because the state said Orange County and the other 10 counties that make up the Southern California region, the state look at our ICU bed capacity and make determination on whether or not a region will be on the lockdown, right? Because when your ICU is minimal, you're in trouble. So we want to make sure that other folks who do not have COVID but have crisis are also well taken care of. And that's why the state went on a lockdown, and we've been on the lockdown since before Christmas, right? And what it is the state look at the number of people who are sitting in the ICU, all the ICU, intensive care unit bed in Orange County and the region. If the number is below 15%, then the state puts you on a lockdown, which we have been, right?
Yeah, and so I think our capacity is closer to 0% right
correct.
now, right?
That's correct.
It's pretty, it's a pretty dire situation for our hospitals, right?
Yeah, and our colleagues up in LA is just amazing. The number is just terrible. And so 2 weeks ago, I asked staff to talk to our hospital partner, the 13th largest hospital in Orange County. And I said, can you tell me who is sitting in our hospital? Because in order to alleviate the pressure in our hospital, we have to figure out a way to really turn off the spigot, right? If the water is splashing everywhere and overflow, you got to turn off the faucet, but you have to know where is the faucet to turn it off. And so to my biggest surprise, when you look at the hospital bed, not the ICU bed, the hospital bed, 24% of the people who are sitting in our hospital are senior at the age of 61 and above. 54%. Did I say 24 or 54? 54.
Okay.
So outside of the ICU bed, don't count the ICU bed, the regular bed, 54% is the age of 71 and over, 61 and older, okay? When we look at who is using our ICU bed, who's occupying the ICU bed, 72% of them are over the age of 61. And significantly, 65 to 74 is the largest number of who is staying in our ICU bed.
Right.
And then you go further and you ask, well, for those people in the ICU bed, who are needing the ventilator?
Right.
73% of the people in the ICU bed who needed the ventilator are individuals over the age of 61, and majority is 65 to 74.
Okay.
So
we've seen, I think throughout the entire pandemic, we've seen that our seniors age 65 and over have been the most vulnerable to this disease, and that as we're in the midst of this surge is really bearing itself out in our hospitals.
Yes.
And I think, and you said that's what led you to take the step to prioritize
65.
vaccination for our seniors.
Yeah.
Got it.
And we don't have enough vaccine. I acknowledge that, but we really have to get to the population that is vulnerable and stop this, right?
Mhm.
I want to share with you this, okay? Even though we say you need 2 doses to achieve 95% effectiveness,
Mhm.
there have been studies that shown even after your first dose, a week after your first dose, both vaccines give you 50% protectiveness.
Okay.
That is astounding, right? And so I have every reason to really need to go in and protect our most vulnerable. Now, when I say 65 and over, but clearly, if you're 65 and older and you are active and healthy, you are at a lesser risk of dying and needing ICU bed than somebody who 65 and older, but yet have other chronic health conditions, right?
Mhm.
Like diabetes, obesity, cancer, lung problem, etc. And so that's why we don't have enough vaccine, but we're going out there. We're asking the community to be patient. Let us give the vaccines to the most senior, 75 and older,
Okay.
and then 65 and older with chronic health condition. Let us protect them first, because they are the one that if they get infected, they end up in the hospital more than others. A third, three-quarter of them end up in the ICU, and then
Okay.
three-quarter of those in the ICU needed a ventilator. So we got to protect our senior.
Yeah.
The
Yep.
number of deaths in Orange County as is related to age bracket, 75% of people who die in Orange County are seniors, 65 and older.
Okay. And so in terms of then the phased rollout. So the phased approach is really based, as you said, on the risk profile. And we want
Yes.
to protect the our
Most
friends,
vulnerable.
family members who are the most vulnerable. So right now we are in what's been called phase 1A. And I feel like sometimes when I talk to people, we have all these tiers, we've got all these phases.
No.
I'm doing my best to kind of make it as simple as possible so that I can keep track of it and everyone else can keep track of it. But right now we're in phase 1A, which is healthcare workers, first
Critical.
responders, long-term care residents, and seniors who are 65 and older.
Yes.
Again, just kind of big picture to set people's expectations. I'm going to tell you what I kind of have understood to be the rollout for subsequent phases, and you can tell me, like, where do we need to make corrections. So the next phase, which is phase 1B and C, will begin probably next month, supply dependent, but that's the goal, is to have enough supply to begin next month with teachers and other critical workers, individuals with high risk health conditions, and moving then into individuals over the age of 50. Once we've been able to vaccinate all of those folks, the goal would be that we'd be able to open up vaccine for everyone. So, somebody like me, I am 45, I'm healthy. I want to have the vaccine. I want to be protected, but I want to make sure that we protect folks that are more vulnerable. So for somebody like me, I'm probably going to be looking at something like an April or May is when I would
hopefully the end of March, right? Remember.
Oh, is that our goal? Okay, we're getting.
Yes, that's my goal, right?
Okay.
That's why I'm pushing the state, and I know you support me pushing the state to bring the vaccine to Orange County, right? Because we heard that other county, there's people who are hesitant, right? Don't want the vaccine, but the headache for me is that too many people want the vaccine in Orange County, and that's a good headache to have.
It's good.
Please
yes.
press me.
Yeah.
I welcome that. And so my job is to make sure that we bring as much vaccine to Orange County as we can, so we can ensure that many people who want it can get it appropriately. Right?
And I know that it can seem frustrating to folks right now. Like we can see that light at the end of the tunnel. We want to get there as soon as possible. But one thing I know that I am really excited about, and I want you to speak to, is Operation Independence. So tell people what that is. And I think I think it's something that we can all get behind and get excited about. And it's really not that far away. So tell us about Operation
So
Independence.
Operation Independence is the goal to pursue mass vaccination for Orange County for those who want it, right? So that we could achieve herd immunity. And you probably heard the term herd immunity thrown around. What that is if 70%, and again, that number changes depending on who you talk to, if 70% to 80, some even said 90% of the population have developed antibody against the virus, either through infection or through a vaccine, then it's pretty much safe for us to walk around and behave like before the pandemic, right? We'll be able to hug each other again. We'll be able to gather with each other again, all that. And our goal is to make sure that we reach that before July 4th. Get it? That's why we call it Operation Independence.
We are going to have such, we are going to make it happen, and we're going to have such an incredible 4th of July party all across the county.
It is. I tease the supervisor in Orange County that each of your districts should have a huge celebration on July 4th when we achieve this. And they up for it, right? And I'm sure you too, you would have a big party for people who live in your jurisdiction to come out and enjoy that freedom, right? Independent from the virus. So that's the goal of Operation Independent. But easy said, not easily done, right? It requires, number one, our community to want to have the vaccine. And number two, how do you push it out quick enough, right? Because we have 3.2 million people in this county. And this vaccine is complicated, at least for the first two that got authorized. It's complicated. One of them have to be stored in a freezer below 80-degree sub-zero. The other one is minus 25-degree. And then when you handle it, when you thaw it, there's a certain amount of time that you must use it. And you can't, one of them, you can't shake it. And then the other one, you have to dilute it. So it's very fragile vaccine. So I know many of my colleagues who are physicians said, oh, when the vaccine comes, I will vaccinate. I will be the one to vaccinate. And then we let them try it, right? And then they called me back and said, oh, no, I don't want to have anything to do with it. This is very complicated because the storage, the transfer, the handling of this virus is very careful. We have to train people, and then you have to report up for each of the individual you vaccinate them with to the state, right? And so it's not like the regular flu vaccine. I still remember when I did the flu vaccine, I just have the homeless people line up in front of me, roll up your sleeve, and then I just give you a vaccine and off you go. I don't have to worry about anything. This one, you have to worry. You have side effects. You have to observe them for 15 minutes. And then when they have side effects, they have to be able to notify someone. And then they need to be reminded to come back for the second dose. And remember, one of them, the second dose is 3 weeks, and the other one is 4 weeks. So what if the person who get the vaccine come back for the second dose and does not remember, well, I don't know which one I got for the first dose.
Right. So
that would not be good. We have to,
that.
We have, so it's a very complicated vaccine, at least for the first two. Now, there are more coming in the horizon that are much more convenient compared to the first two. So it's coming. So I'm very hopeful. So I'm hopeful that more coming.
We're mobilizing. I mean, the reality is you're mobilizing an incredible countywide operation to achieve the goal of Operation Independence, which is to achieve community immunity by July 4th. And there's a phased rollout that's underway right now. So if I'm somebody who is in this, I'm now eligible in the first phase. So if I'm a senior who is 65 or over, what do I do now? How do I make an appointment? You've mentioned that there's a constrained supply, so I know I can't get an appointment tomorrow, but how do I get in the line, and what should I expect right now?
So you probably have heard of the term OTHENA, OTHENA. So OTHENA.com. We partner up with an international app developer who are headquartered here in Orange County. When I took the job, this job, in May, anticipating the vaccine and what I was following and studying with the literature in this vaccine, I knew it was going to be very complicated. And so I charged staff with, please go out there, find an app developer or an app that give us the solution to really make this process as smooth as we can. And this app, this platform has to be able to communicate and do the reporting to the state, right? So we talked to, I can't remember, 6 or 7 app developer, and then we found this one who has something that are close to what we needed. We know we needed, and so we work with them. And so the Othina app was developed out of that partnership.
Okay. And folks can find the Athena app if you just, I think it's just Othena, OTHENA.com.
Or go onto your iOS app store or the Android app store. It should be in there.
Okay, so it's on your, it's on my phone. It's on an app.
Yes.
It's also on my computer. I can find it either way. Okay, so it's Athena, and so Athena is a highly secure app that matches you with vaccine providers, will set up appointments and guide you, or
through the whole process.
During the whole process. So right now, not everyone is eligible to make an appointment, but people can pre-register. Is that right?
That's correct. That's correct. That's correct. So we just beginning to even go down the list of people who register, pull out the most at risk. In this case, will be the senior, and then we'll give them an appointment, right?
Okay.
That's one way for you to do that. The other sure way is also talk to your family doctor. Hey, I'm interested. So maybe they can help you sign on to Othena, okay? And for our senior who have difficulty with mobility and transportation is an issue, contact your local community senior center and let them know you're interested.
Okay.
So we have worked with 26 local city senior center, community center, and say, hey, compile a list of those senior who want the vaccine, because we do know that currently the apps and the platform is in English. We are going to translate it into Spanish, Vietnamese, Korean, and Chinese. But right now, if you have a language problem, your senior center could help you and make sure you have a list. And what we'll do is we take that list, right, ask the senior center to help you, and then we upload it to Othena.
Okay. All right.
And so when we come to yours, because beside the super pod that you heard about, right, at Disneyland, and you probably heard that we're going to open the second super pod this Saturday at OCHA University, right?
So tell us, just for folks at home, if folks aren't aware, tell us a little bit about these super sites, because there's now 2 super sites in the county. So tell us a little bit about those first.
So remember I talked about how to vaccinate 3.2 million people is not going to be an easy task. And so we need to have a site that will be able to vaccinate, give us an output of thousands of people in order for us to reach that goal, right? And so we created the concept of super site, where we envision that each site we will be able to vaccinate somewhere between 7,500 to 8,000 people a day. And we are looking to open up at least five sites strategically around the county in order for people to have convenient to go to. Simultaneously, the pharmacy will be helping us to vaccinate as well. For those people who don't want to come to a super site because you have anxiety in a crowded place with a lot of people, you can go to some pharmacy. We're working out the detail with some pharmacy in Orange County. And then the hospital system will also be supporting us. Once they finish vaccinating their staff, the high-risk staff, they will begin to vaccinate the community, and they're going to help us. And then, of course, for some of the community clinic in Orange County, or some large physician group in Orange County, or small for that matter, when we have plenty of vaccine, we will ask them to help us to vaccinate the community. And then we have a mobile pod. So I'm not talking about the mobile part yet, but here it is. every week on Wednesday, Friday, and Sunday, we will deploy it started already, we will deploy a mobile pod working closely with the senior community
Okay.
center, and to pull out the most vulnerable who are not able to, because of one reason or the other, come to the super site, come to the hospital, come to the family doctor. So we're going to go into the community setting, into the community center and vaccinate them. It just
Okay.
started already. I
Good.
know, because
Great.
I operate and I am one of the vaccinator for the Sunday pod. So I will
Oh,
come to a place
wonderful.
closer to your home, and you might get me as your vaccinator.
Okay. All right. So right now, so we've got the super sites. There's the one at Disney is up and running.
Yes.
The one in Aliso Viejo, which is going to be at Soka University, is going to be online
This
starting
Saturday.
Saturday.
Yes.
We'll also start to see distribution
More,
rolled
yes.
out to hospitals, to pharmacies, and
Clinic.
these mobile
Yes.
mobile units.
Yeah.
Right now, folks should they can either go to Othina to pre-register, or as you said, if they're not able to do that, and or if they're not mobile, you can go to your local senior center. Or for folks watching, if you need help, we can help you register on the Othina app, or we can help connect you with the right resource in your local senior center to get you in the line. Just one other question that we've gotten on Othina. So I filled out the pre-screening questionnaire on Othina. What happens now?
So we go, as I mentioned to you, we go down the list, pull out your risk, right? And then we'll make an appointment for you and we will inform you. Okay.
Okay.
So at this point, because we only have 2 super sites, you'll probably be assigned one or the other based on where you live. Eventually, we will have more sites, then it'll be much more convenient for you. But I tell you, ma'am, when we opened Disney, I had senior citizen that came up from South County and they went to Disneyland and they just love it completely and they enjoy it, and
Good.
it was good. It was
Good.
really heartfelt for me to see our senior really do that. And then on the weekend, on the Sunday, I know we have some senior who have a bit more trouble with mobility who came out to the senior center that we set up shop. And yeah, it's really, really nice. It's given me so much joy and hope that we're able to do this for the community.
Wonderful. Wonderful.
So the only thing I ask for is a little bit more patience. I'm sure you, Assemblywoman Petrie-Norris, will support us in talking to the state to bring more vaccine to come to Orange County, because our residents want it, right? The resident in Orange County want the vaccine. So I already told my colleague, health officer in other county, any one of you who have leftover and your people don't want it, send it my way.
Bring it here. Now, I've got a couple of constituent questions that I just want to try to answer really quickly, and I think some of them we even have. But my mom is in her 80s; she has trouble getting around. How will I be able to get her the vaccine? Sounds like you should reach out to your local senior center, or reach out to our office, and we can help connect you. I'm a teacher. I don't want to go back to my classroom to teach until I have a vaccine. When should I expect to get one? Are teachers a priority for the vaccine?
So I think the teacher is in phase 1B, and the state is deciding the tiering right now. I suspect that probably sometime, again, based on how much vaccine is available, I'm suspecting that sometime in mid-February to late February.
Okay. All right. So mid to late February would be the goal for our teachers and other really just critical essential workers. When will my teenage son and elementary school aged daughter be getting the vaccine? Is that
so? That is a good question. Currently, Pfizer vaccine is authorized for 16 and older. Right?
Okay.
So the only teen that are eligible at this point, when is their turn, would be 16 to 18. The Moderna vaccine is 18 and older.
I see. All right.
Both companies are conducting clinical trial for 13 and above right now. And then once they finish that, they're going to move into 5 to 12. Okay. So usually younger than 5, they will infer because of the response from the 5 years old and so.
Mhm.
I don't know if there's any plan to really test it out in kids younger the age of 4. I
Oh,
imagine that somewhere in the world, somebody is conducting that, but we
okay.
know that that's rolling in slowly. And so, yes, for teenager, if they are somebody who have chronic health condition when we move to 1C or so, and if we don't have the authorization for younger than 16 in case
Mhm.
of Pfizer, then the teenager from 16 to 18 could get Pfizer when it's come to their tier turn.
Okay, understood. But it sounds like for younger children, the vaccine
Not
is still
authorized
being
yet.
evaluated
That's
for
correct.
younger children, which again, I think that points to the fact that every precaution is being taken to ensure that this vaccine is rolled out safely and
Yes,
effectively.
yes.
Um, okay, two more questions. My mom lives in a memory care facility. When should she be getting the vaccine? Her facility doesn't seem to have any information. Who should they or I contact to get their residents vaccinated?
Okay, so the facility managers should contact me
Okay.
because we know that each of the facility, as I mentioned early on in the program, each of the long-term care facility has been matched up with either CVS or Walgreens. It's
Yeah.
just a matter of when they are scheduled to get the vaccine.
Okay. All right. I'm going to pass that one on. I run a child care center. When and how can I get my employees vaccinated?
Yeah, I think child care center is also part of the ones
Yeah.
B. So please wait. The state has not finalized when that is yet. So
Okay. But likely, as you said, likely sort of mid to late February when that will happen. And my understanding is that the county and our hospital partners will actually be reaching out to the facilities themselves
right.
to commence that rollout.
Okay.
Okay. And let's see. The vaccine website only recognizes birth date and whether you are a worker in the 1A through C category. How will I know if I become eligible based on other characteristics? For example, how will a person with a high risk health condition be notified?
So currently, if you are 65 and older, you should know. But by the time when other people younger than
Mhm.
that
Yeah,
with chronic health condition will post it on the website.
I
And
see. Okay.
most of your doctor will inform you, hey, you're eligible for the vaccine now, and go ahead and get your
Yeah.
vaccine. We work very closely with the Orange County Medical Association, so information will be sent out to the physician that way as well.
Okay. Wonderful. Um, and actually, I want to come back to something that you referenced a little bit ago, because I've gotten questions about the UK's approach.
Yeah,
So the UK recently announced that they are going to move to a one dose strategy to
yeah,
provide as many people as possible with some level of immunity.
yeah.
What do you think about that? And what are the trade-offs?
So I think the UK decided to do that because of there's evidence now that for both vaccine, a week after you receive your first dose, the effectiveness is around 50 to 60%, right? Believe it or not, it's pretty close to the seasonal flu vaccine. And that's why, because of scarcity, because of the limited number of vaccines that's made available or produced, that's why the UK was moving into that direction. As far as we know, up until even today, the CDC and the FDA is still recommending that in America, we should finish the dose, the 2 dose,
Okay.
the cycle. That's what I call it. Okay.
Okay. And how are you going to make sure that healthy people don't cut in line?
It's an honor system, right? And that's why I'm pleading to the community to be patient and allow room for the vulnerable. The California Medical Board have issued now twice warning to physician that if a physician is being reported that they are offering the vaccine out of turn, that their license might be in jeopardy. So the California Medical Board is very serious about that. And we internally in Orange County, we have sent a letter to all of our certified provider who provide these. So in order for you to give out the vaccine, you have to be certified, COVID vaccine, you have to be certified by the state. So we have sent out a letter to all the people who were certified by the state that we will be auditing them, as well as warning them that here is the warning information from the Medical Board of California in case you don't read it or you forgot to read it or you toss it down the trash. So we have sent out information to all of the certified provider in Orange County and warn them of that.
Got it. Well, and I know it feels like throughout this pandemic, I think we've been reminded time and again just how much, we are all in this together.
Yes.
And our individual actions collectively have enabled us to flatten the curve in the past, have enabled us to beat this virus. And I think, again, as we think about the vaccine rollout, we have to recognize that once again, we are all in this together, and it's everyone doing the right thing that's going to get us to the solution most quickly.
And at the end, our goal is to protect our most vulnerable, make sure people don't die from COVID, especially when hope is here, is so close. We are so close that each life lost is precious and unfortunate, and even more unfortunate now because we do have solution to this. So.
Yeah, well, and I think when I think about, the few things I hope people take away from our conversation today, number one is what you just said, hope is here. Number two, the vaccine is safe and effective. Number three, the rollout is underway in Orange County and will be ramping up really quickly in the weeks and months ahead. And lastly, you can pre-register now on OCHA in order to get in line and to be notified when it is your turn. Are there any parting thoughts that you'd like to share, or any key ways that you want to make sure people come away with?
If you don't feel well, stay home. Continue not to gather, because we do know that that's the most effective way to spread the virus, right? Continue to wear your face covering when you are not alone or when you're not with the people who are living under the same roof. You gotta continue to do that. Stay 6 feet distant from people who don't live in the same home with you, and wash your hands frequently.
Well, thank you, Dr. Chau. Thank you so much for joining us today. And thank you for everything that you are doing as the director of the Orange County Healthcare Agency. I know that you care deeply and passionately about keeping our community safe. I know you and your team have really been working tirelessly to protect our community and to beat this virus. So, so grateful for you. And to everyone at home, as Dr. Chau said, hope is on the horizon and there is a light at the end of the tunnel. Please be safe and stay strong, and we'll see you for our next town hall.
Yes, stay healthy, everybody, because I look forward to the day where I can meet you in person.
Yes, and we're all looking forward to celebrating together.
Yes.
Operation Independence. Operation Independence is not too far.